So I think one of the things when I just kind of quickly analyzed her was I felt like she had these downturned lips, that line. Do you guys see it? You're smiling. Stop smiling.
I'm not smiling.
Yeah, that. See that stuff. And when she leans back, it's not as prominent, but it's this stuff and that wrinkle, and it just kind of makes your lower face not as balanced as it should be. And then some of these, she doesn't really have nasolabial folds. She has kind of flat cheeks though, so I don't really see a lot of like fullness here. I feel like this is a little puffy and this is not. And so if I can lift her cheek up a little, it'll help this and it will hide that puffiness. Do you guys see
Good.
it? And again, when you lay back, it gets a little bit better. I mean, nothing here is so horribly obvious, but it's pretty quick. So let me just get started. And I'm going to use 2 different products today. I'll do the cheeks first because they're quick. I'll probably just do one side for you guys so you can compare. And then
she'll do the other
before
side
and after. I'll do the other side. You don't necessarily have to watch the other side because it takes a while. And try not to think about the needles. It really doesn't hurt that much. And it gets numb as I go.
Yeah.
I usually have some music in here to but we put it outside. It's out there. So no music today for you.
We talk you through it though.
You want me to
Have a
sing?
good time.
Are you a good singer?
Christmas music, please.
So again, what I'm trying to achieve here is a little bit more width to her cheekbone area and not so much width here. Do you guys see that when you analyze the face, she should be more, ideally, we want to be wider around the cheekbone eye area and not so wide here. And we get wider here because everything's falling. So sorry.
That's all right.
So I want to make her wider here. That's the goal.
I'm old. That's supposed to happen.
What's the product?
This is Voluma, the Juvederm product, an Allergan product that reps are here. This product lasts 2 years, so I like it a lot. And it matters what you use in the cheeks because this has a lot of like lifting power. Like if I were to squirt it out on this piece of paper, it would actually stay like in a tent, like it would stay upright. And some of them, like Restylane, not that one, but a different Restylane, I would squirt it out here, it would pull out like a lake. So you wouldn't want to put that one in the cheek, it wouldn't do anything. So it does matter what kind you use and where you use it. So this one I like a lot for the ability to lift, and that it lasts 2 years is really nice. Because nobody likes to get poked. I mean, it doesn't hurt that much, but nobody likes getting poked. Okay. I'll lay you back just a smidge.
Do you numb that area first?
Nope, it has numbing in it.
Numbs as you go.
You tap on her to kind of distract her. Hold that for you. How'd that? Not terrible, right? Just the needle poke's just sharp, but it goes right in. It doesn't. It's not that bad.
Yeah, it's pretty quick.
It's not.
There are some areas of filler that are pretty painful, like the lips and the upper lip lines, but the cheeks and even this area really isn't that bad. I'm just going to hold that one for a moment because it did bleed a little bit. Most of the time they don't actually bleed or bruise in this region. So. Your necklace is pretty.
Thank you. Changed 3 times.
Did you?
It's the perfect
That's
one.
funny.
It
Well,
works.
this one is perfect, yes. That's good now. All right, we're going to move on. You can always look away if you just don't like looking at the needle.
Yeah, you got it.
Okay, good job. Be done soon.
The best part is that I don't see the needle.
Yeah, exactly. You just think about the results.
So all filler is done differently. So this filler is done pretty much on the bone. So I don't have to worry about getting this into a blood vessel or some problems. There are no blood vessels on the bone. So in case there's different techniques for every body part. I wouldn't go in directly like that in like this area here. I'll go in much more superficial. So just holding, smoothing it out. Okay, and I'm almost done with this half. good, so I'm just gonna smooth it out. Now I'm gonna do a little bit different technique to give her, let's just smooth it, 1, 2, 3. How's it going?
She's not even finished.
You gotta just try not to think about it, because it probably is somewhat numb already from the previous injections. So you just have to try not to think about it.
It's true, if you don't see it, I think it's probably more painful for you than it is for
To look
me.
at it.
I have my close-up glasses on, so I can't see I'm far away. I can't see the needle. But from right here, I can see it just fine. These are like not even readers, they're even closer than readers.
You're the one that needs to see.
That's right, yeah. It's funny, when I went to get some to help me with filler, the readers that they gave me, that he assumed I just needed readers, they didn't work, because I'm too close.
Yeah.
And so I told him, you know, I get like really, really close. But the downside is that I need readers and these ones. I have to carry more than one pair of glasses around. That's okay. It's hard to get, your eyes just get old fast. Okay, so let me see, I have a smidge left of this one. I think it's already looking more lifted. Let's see, yep. All right, one more time with me.
You're doing a great job.
Good job. Both of you. You too. All right, so that part is done. So we're gonna save that, come back to this. And we're gonna do down here, and then we'll compare sides. Everybody still with me? Never lost anyone yet?
Just one.
So this product is Restylane. Just hold pressure for me.
Yes, absolutely.
This one is Restylane, and this is a newer one. It's called Restylane Define, and I think it's made by Galderma. Yeah, Galderma. And this product is really cool. They market it as, so it's elastic. So this one, if I were to kind of squirt it out and place it here for you, it would stay, it has shape, it wouldn't pull out, and it would be like almost sticky, like elastic. So when you put it in your folds or areas that move a lot, the theory behind it is that it will move with your facial expression and be more natural. So one complaint some people have is when you put it in the fold and you do a non-elastic product, and when you smile, you know, it just doesn't look quite as natural. It can, but it's just some people complain of that. And same thing for here, when you're at rest, when we're doing it, it looks fine, but when you smile, it's just almost like a stiff area, and it's noticeable to those in the know. So that's what this product is, why it's different.
How long does that last?
This one lasts a year. I think I'll stick with my 28s. Okay. So this one is a little owie right in the beginning. Couldn't get it off. But it gets numb fast, as I mentioned. There. Clean you off a little bit. Alright, you're good. So what I'm trying to do is turn this corner up. Sit you up a little bit.
Turn my frown upside down.
Turn your frown upside down. That's right.
That's where I got it from.
Wasn't there a jingle about that?
Yeah.
Yeah.
It's a little song that you teach kids.
Yeah, you would know, wouldn't you? Okay, open wide. Okay, not that wide. Perfect. So when I do it this, trying to get it right in chin up.
You'll like this one. Looks great.
So pinch, not too bad.
Does that have numbing?
Yes,
in it
ma'am,
too?
it sure does. Close. So you can tell it's already, I only did a smidge. It's already lifting her corner. Can you guys see that?
Yeah.
So it's rather dramatic usually. I've only used about 15% of the syringe so far open. Just wanna squeeze. Alright, so again, she's laying backwards, so I don't see this little, I have to kind of recreate it. So I'm gonna try and come across it. That was a new area, so she might have flinched ever so slightly. So you see how the technique is completely different? So that's why you want your injector to really know and be familiar with all the fillers. And Dr. Cote and I are just, we do every single one that is out there, well, except the ones we don't think are worthy. And they all have different consistencies, they all have different, how hard you push, and it matters. It all matters. Okay, another poke, honey, I'm sorry. 1, 2, 3. I just want to kind of get this divot here. So we have facial expression muscles that kind of, after 40 years of making the same facial expression, they create dimples, and so we're trying to hide those. All right, I'm almost done with you, and then we'll compare, okay? I've done about 1/4 of this syringe. Open up. You do a lot of smoothing out, and then looking and analyzing. Every patient is different. Everyone needs it in a different spot. You still have, see when I do that, she still has that line, so I have to continue. I just have to keep going. I'm going to change my technique for that last little bit. How you doing? For that, it can bleed there, so I want to use something called a cannula. If you're kind of, what's the word? Not queasy, but sensitive, you may not, you just might want to close your eyes just for the, a cannula is not, it's rounded, so it doesn't go in like a needle. So, it's good because it doesn't bruise you, but it feels different. So because of that, I have to make a poke. And it doesn't hurt her, it's actually less painful, but it looks worse, so that's why I told you to kind of, you might not want to look.
You must have a real high pain tolerance.
I would say most people do.
She doesn't, nothing.
Most people do pretty well.
Yeah.
So this, I
You do
told
better
you,
than you think you
yeah, even under the eyes, people do pretty well. They're always more scared than they need to be, because in the end, it's not as bad as they thought. And you're kind of numb now, aren't you?
Mm-hmm.
I mean, this whole triangle is probably pretty numb now at this point. I can do anything I want.
Is it numb like the dentist kind of numb, or?
No, no, just skin numb.
Mm-hmm.
Not as densely numb as that.
Yeah.
right? Because then, everything is kind of numb. You see how I have to tug and push a little, so if you're kind of queasy, that can be just, but it doesn't hurt her. I promise.
Well, she's handling it well.
Yeah. No, seriously, it probably bothers you more than me because I can't see it.
Right,
right.
Yeah,
And it is numb. I don't feel anything.
So even though it looks rougher, this is actually more delicate. Definitely a technique to the cannula. Okay, so again, what I'm trying to do is camouflage the jowl area. Okay, open.
It'd be awesome if they'd make something that would last more than a year.
They do. Voluma lasts 2, and Valor lasts 18 months. So they do. Bellafill lasts 5 years. We're not doing a Bellafill demo today. So they have a 5-year filler out. So they do. The price goes up when you're doing that, so it's a catch-22 because it's already somewhat expensive for a syringe of filler, and so you have to pay. It's more expensive for the longer they last. Since I wiped all her skin oils off, I was gonna just take a look. Now, so it'll get better tomorrow because it pulls fluid to itself. Hyaluronic fillers, HAs, are water-loving molecules, and so why they look so natural is they pull water to themselves. And different fillers pull water in different amounts. So some pull lots of water, like Juvederm, and some pull very little water at all, like Voluma, the one we did in her cheek. This one is kind of mediocre, like middle.
They sell vitamins and things with hyaluronic acid in it. Does that do anything for your face too, or is that
No,
different?
the studies have shown that dietary hyaluronic is not very effective at all.
Even for arthritis and things like that?
I didn't look at it for that, from that angle, but for a skin angle, that one, yeah. Just a little bit hollow right in that little spot. So, go back and forth and I analyze and look and analyze again. So she's may take more than a half of a syringe on each side. Everyone's different. It's a little better. Alright, and sit up with me. Well, you definitely have, this is much better. I think we're just gonna have to finish the syringe on your right cheek and then we'll do a whole syringe on your other cheek. So lay back down and let me just finish this Voluma. And you guys are good. Turn that way. Cool.
Thank you.
Thank you.
Oh, you know what, I'm a little under the weather, it's like I didn't eat that today.
That's really good. I'm just messing this side.
Yeah,
It's
right,
really good.
here you can see. We lost all our people.
Oh, yeah.
Turn towards me. It just wasn't quite right, and you needed a whole one. Done. Finish that syringe on you. Okay, so you were going to be a little tender when you wash your face, if you recall.
Okay.
And I just do it all. I think it's okay.
Okay.
So we finished one side. We put a syringe of Voluma in her cheek here, and then we also treated this area, this triangle here, to kind of give her a little lifted look. And I think that she's looking more lifted as we speak. And here's a mirror. Could you just describe how it feels or how you think it looks?
Oh yeah, that looks good. You can tell a difference between the two sides, definitely. Doesn't hurt at all. It feels fine.
And then you've had filler before, so you know it smooths out and looks better tomorrow.
Correct.
As soon as we're done, it almost looks a little lumpy, but it smooths out sometime tonight, and then it looks great. All right. Thank you so much.